Hello viewers. Welcome to our channel. In today's video we have brought you another new content. Before that you have subscribed to our channel. If you haven't subscribed now, click the bell icon next to it and give us encouragement. Today, we're diving deep into a critical topic that affects many lives: heart attacks. In this video, we'll explore what exactly a heart attack is, the causes behind it, its symptoms, and most importantly, how to prevent it. So, let's get started. To understand heart attacks, we first need to know a bit about our heart's anatomy. The heart is a vital organ responsible for pumping oxygen-rich blood throughout our body. A heart attack, also known as a myocardial infarction, occurs when blood flow to a part of the heart muscle is blocked. To understand heart attacks better, let's take a closer look at the heart's anatomy. The heart is a powerful muscle that pumps blood, carrying oxygen and nutrients, to the various parts of our body. This process is essential for our survival. However, when a blockage occurs, the blood flow is interrupted, and this can lead to a heart attack. When a heart attack occurs, the affected part of the heart muscle doesn't receive enough oxygen due to the blocked blood flow. As a result, the muscle cells begin to die. This can lead to long-term damage or even life-threatening complications if not treated promptly. Now, let's explore what causes this blockage. The most common cause is the buildup of plaque within our arteries, a process called atherosclerosis. Plaque is made up of cholesterol, fat, calcium, and other substances that gradually narrow the arteries. Eventually, a plaque can rupture, leading to the formation of a blood clot that blocks the artery and cuts off blood supply to the heart muscle. The buildup of plaque within arteries, also known as atherosclerosis, is a primary cause of heart attacks. Plaque is formed from cholesterol, fat, calcium, and other substances that accumulate on the inner walls of arteries over time. This buildup narrows the arteries, reducing blood flow. If a piece of the plaque breaks open, a blood clot can form around it, blocking the artery completely and causing a heart attack. Sometimes, heart attack symptoms can be subtle, especially in women. Women might experience symptoms like unusual fatigue, indigestion, or discomfort in the upper back, shoulder, or throat. Additionally, some people may have what's called a silent heart attack, where they experience minimal or no symptoms at all. This is why regular checkups and knowing your risk factors are so important. Recognizing the symptoms of a heart attack is crucial for seeking immediate medical attention. Symptoms can vary, but they often include chest pain or discomfort, which can radiate to the arm, neck, jaw, back, or stomach. Shortness of breath, nausea, cold sweats, and lightheadedness are also common signs. Recognizing the symptoms of a heart attack can save lives. Chest pain or discomfort, often described as pressure, squeezing, or fullness, is a common symptom. This pain can radiate to the arm, neck, jaw, back, or stomach. Some people might experience shortness of breath, nausea, vomiting, cold sweats, and lightheadedness. It's important to note that not everyone experiences the same symptoms, and some might have milder or atypical signs. Certain factors increase the likelihood of experiencing a heart attack. These include smoking, high blood pressure, high cholesterol, obesity, diabetes, a sedentary lifestyle, and a family history of heart disease. Age and gender also play a role, with men over 45 and women over 55 being more susceptible. Our health. Smoking is a major risk factor, as it damages blood vessels and accelerates plaque buildup. High blood pressure forces the heart to work harder and damages arteries, increasing the risk. High cholesterol contributes to plaque formation. Obesity, especially when combined with a sedentary lifestyle, can strain the heart. Diabetes is a risk factor because it affects blood vessel health. Having a family history of heart disease and age also contribute to the risk. Certain lifestyle choices can significantly increase your risk of heart attacks. Lack of physical activity contributes to weight gain and poor cardiovascular health. Stress, especially chronic stress, can lead to unhealthy coping mechanisms like overeating or smoking. Excessive alcohol consumption can raise blood pressure and contribute to heart disease. It's important to address these factors for a healthier heart. Adopting a heart-healthy lifestyle can significantly reduce your risk. Focus on maintaining a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise, stress management, quitting smoking, and managing chronic conditions are also vital. Preventing heart attacks starts with adopting a heart-healthy lifestyle. Eating a balanced diet low in saturated and trans fats can help manage cholesterol levels. Incorporating regular physical activity, such as walking, jogging, or swimming, improves cardiovascular health. Stress management through techniques like meditation and yoga can also play a significant role. If you're a smoker, quitting is one of the best decisions you can make for your heart. Regular health checkups and managing chronic conditions like diabetes can further reduce risk. If you suspect a heart attack, don't hesitate. Call emergency services immediately. Timely treatment can minimize damage to the heart muscle. Paramedics can provide vital care even before reaching the hospital. Remember, time is of the essence. If you suspect a heart attack, don't hesitate to seek help. Call emergency services immediately. Paramedics are equipped to provide critical care on the way to the hospital, which can minimize the damage to your heart. Every minute counts, so it's essential to act quickly. Once at the hospital, healthcare professionals will perform tests like an electrocardiogram (ECG) to diagnose a heart attack. Treatment may involve medications to dissolve the clot or surgical procedures to restore blood flow. If you are at a higher risk due to factors like family history or existing conditions, consider talking to a healthcare professional about preventive measures. They can provide personalized advice on diet, exercise, and medication if needed. It's also crucial to know the location of the nearest medical facility and the emergency number in your area, so you're prepared in case of an emergency. A heart attack, or myocardial infarction, occurs when there's a sudden blockage in one or more of the coronary arteries, which supply oxygen-rich blood to the heart muscle. This blockage is often caused by the rupture of a plaque, leading to the formation of a blood clot that obstructs blood flow. When the heart muscle doesn't receive enough oxygen and nutrients, it can lead to severe damage or even death of the affected tissue. While atherosclerosis is a primary cause of heart attacks, it's essential to understand the underlying factors that contribute to this condition. High levels of LDL cholesterol, often referred to as bad cholesterol, are a major contributor to plaque buildup. Uncontrolled high blood pressure can strain arteries, making them more susceptible to damage and plaque formation. Additionally, chronic inflammation within the body can weaken the arterial walls, making them more prone to plaque rupture. Imagine an individual with a history of high cholesterol and uncontrolled hypertension. Over time, plaque accumulates in their coronary arteries. One day, due to a combination of factors such as stress and inflammation, a plaque ruptures, causing a blood clot to form. This clot blocks blood flow in a coronary artery, leading to a heart attack. Heart attack symptoms can vary widely and can be mistaken for other conditions. Sometimes, the pain or discomfort can be subtle and not necessarily confined to the chest. For instance, pain in the upper abdomen, shoulder blades, or even the teeth can be indicative of a heart attack. It's also important to note that some individuals might experience symptoms for weeks or even months leading up to a heart attack, a phase known as unstable angina. Let's consider a person who experiences episodes of chest discomfort, shortness of breath, and fatigue after physical activity. These episodes might come and go, causing the individual to dismiss them as mere indigestion or fatigue. However, these recurring symptoms are warning signs that should not be ignored. Eventually, these symptoms worsen, and the individual seeks medical attention, discovering they have unstable angina that requires immediate intervention. Understanding your risk factors is crucial for heart attack prevention. Diabetes, for instance, can damage blood vessels and nerves, increasing the risk of a heart attack. Family history plays a role, as genetic predisposition can influence cholesterol levels and overall heart health. Lack of physical activity, poor dietary habits, and excessive stress can compound the risk, especially when multiple factors are present. Consider a middle-aged individual with a family history of heart disease, who leads a sedentary lifestyle and has recently been diagnosed with type 2 diabetes. This person's risk of a heart attack is elevated due to both genetic and lifestyle factors. However, armed with this knowledge, they decide to make significant lifestyle changes, including adopting a heart-healthy diet, engaging in regular exercise, and closely monitoring their diabetes. Preventing heart attacks involves a multifaceted approach. Engaging in regular physical activity helps maintain healthy weight, lowers blood pressure, and improves cholesterol levels. Dietary changes like incorporating more fiber, reducing saturated and trans fats, and limiting processed foods contribute to heart health. Stress management techniques such as meditation, yoga, and mindfulness can also play a vital role in prevention. Imagine an individual who leads a high-stress lifestyle due to their demanding job. Over time, this chronic stress takes a toll on their cardiovascular health. Recognizing the potential risks, they decide to incorporate stress relief practices into their routine. Through meditation and regular exercise, they not only reduce their stress levels but also positively impact their heart health, significantly lowering their risk of a heart attack. While recognizing and preventing heart attacks is crucial, understanding the potential complications is equally important. A heart attack can lead to various complications, including heart failure, arrhythmias, irregular heartbeats, and damage to the heart valves. Seeking immediate medical attention is vital. The quicker medical intervention occurs, the better the chances of limiting damage and improving outcomes. Consider a scenario where an individual experiences chest pain and recognizes it as a potential heart attack. They call emergency services promptly, and paramedics arrive within minutes. The paramedics initiate interventions to restore blood flow to the heart, minimizing the extent of damage. The individual is rushed to the hospital, where further treatments are administered to prevent complications. Their quick actions and the timely medical response contribute to a successful recovery. Heart attacks are complex events with a range of contributing factors. By understanding these factors, recognizing the symptoms, and adopting preventive measures, we can significantly reduce the risk of heart attacks. Remember that knowledge is a powerful tool in safeguarding our heart health. Share this information with your loved ones, because spreading awareness is key to promoting a heart-healthy society. Thanks, see you again in the next episode. Please like, comment, share and subscribe to this video and encourage us to bring more new content to you.